You're listening to the Pace Radio Network here at paceradio.net.
The opinions of the individuals during this broadcast are their own and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Good evening, everyone, and welcome to the Pace Radio Show. We're live here at paceradio.net and cbgtv.com. Good evening, Tamara.
Good evening. How are you today?
I'm doing pretty good. It's been really busy today, but the day's almost over, and be able to get some rest. I see you got a familiar-looking T-shirt on.
Yeah. I can, wear this kind of stuff to work, so I do.
Right.
So
I was telling you that we got last week. You remember during the program, we were waiting for Dana. We were dealing with Dana before he came on. We were having a conversation with Lawrence Chignac.
Yeah.
So since then, I've been having conversations with him. We've talked on the phone. We've been messaging back and forth. We've come up with some ideas, and we're going to have a coloring contest.
excellent.
Yes. Yeah. To help educate people, right?
Oh, yeah, that's exactly what we need to do. Educate.
Yeah, because he's an artist.
That's right. And yeah, I think there was something that was popped into my inbox that was beautiful today.
Yes, he did. He sent both you and I a gift, and they are our initials done in 3D and covered in cannabis leaves.
Yeah, it's beautiful. So thank you if you're watching. If you're not,
Yes.
I'll send you a little note anyway. But yeah, I really appreciate it. They're absolutely gorgeous. Thanks, Hal, for putting me in that too.
I just passed them on. It was Lawrence offered. And I said that you love them, and I just said pass them along.
Yeah, I'll add them to my stuff too for my show too.
Yeah, so there'll be more on this coloring contest as we go along, and then we're gonna have Lawrence on the show down the road after the contest.
Awesome. Well, that's right. And you had said that you kind of recognized the name when we were chatting with him last week, and then it all clicked as to where you met him and how you know him. And
yeah, exactly. And I mentioned one of the advocates' names where I had heard about him from, and he recognized he knew the name.
Quick question for you, actually, now that I'm just thought about it. Georgia Tunes, is that who? I haven't seen or heard anything about Georgia for a while. And then you were visiting with Naomi, so let's do a little how is she doing?
Naomi's doing good. We went for a walk. We went over to the park. We had lunch over at the park, actually. She's still got some recovering to do. She's had some surgeries, right? So, so she's got some recovering to do, and then she's heading out west, visiting her daughter.
Out west or out east?
West, yeah, I know. I said the same thing.
when did are we talking about?
She's heading. No, her daughter's Regina.
Oh, well, that's great.
Yeah.
Well, I thought west. She was coming as far as me because I'm west.
No, yeah. Still a couple provinces this way, but yeah.
Yeah, actually, my mom was born in Regina.
Oh, okay. Well, there you go. So you know the area then, or
Well, no, I've never been there. I've been to Saskatoon for a cup, and that's it.
Yeah, no, she was doing really good. We had lots of conversations. We were probably there for 5 or 6 hours.
Oh, that's great.
Oh yeah.
That's great. I'm glad to hear that.
To see some other people that came in as well.
Yeah, Debbie was there too. I saw Debbie Switz was there.
Yeah, Debbie was with me. 420 Deb. She she come down and got to.
Well, quite frankly, I think there was a whole whack of us that were worried about Naomi.
Oh yeah, there was for sure.
When I had the incident at my first visit to TY, it was Naomi that I stayed at her place too. Like she kind of saved us, right? Because
Yeah.
we didn't, like our hotel was in Markham. We had no way of getting to Markham, so yeah. So I stayed with Naomi in Toronto. It was great. So I was a little worried about her.
Yeah,
Yeah,
for sure. For sure. Yeah, no, she's doing good. So
good. And you don't know anything about Georgia? Like, have you seen?
no,
No.
no. Sorry, I can't update you on anything there. So alrighty, what do you say? Time to bring in our guest?
Absolutely. I'm really interested in hearing what he's got to say.
That's right, same here. Well, with all of our guests, we like to welcome someone who works hard to educate, and he does research on cannabis-related information, plus so much more. But instead of me telling you all about it, we like to welcome our guest, Dr. Daniel Bear of Humber College in Toronto. Hello, Dr. Bear. How you doing?
I'm doing great. How are y'all doing?
Good. We're happy to have you here on the show. I understand, the way we got connected, it was basically you sent a message through our website, and I read what you were up to, that you were doing some research, and you've been doing research on cannabis and other stuff throughout the years. Your resume there looks quite impressive. I recognize a lot of the groups and things that you've been associated with in the past. Especially on my early times of getting involved in this cannabis end of stuff. So instead of me telling everybody about you, why don't you fill us in a bit about your background and what you've been doing, and then we'll get into this latest project.
Yeah, for sure. I mean, the latest project is also called PACE, and that's actually how we connected there. Because I Googled our name to see, make sure we weren't going to overlap with anybody, and I said, "Oh yeah, no, I remember this. Okay, yeah." No, so I've
And we're still here.
No, thankfully, I've been in cannabis now for 20 years, actually 21 years now at this point. But I started off, even before I was involved in cannabis professionally, I started off as a medical cannabis consumer. And I was 16. I'd been seriously assaulted, and I was using cannabis to deal with the PTSD and the physical pain and the traumatic brain injury. And, there was just nothing out there. There was no information. I felt kind of isolated, stigmatized. I started seeing, I was growing up in Los Angeles, and I started seeing friends get arrested, and I started really noticing the racial disparity in the way that my Black friends were treated different from my white friends. And at 16, I was a bit too young to put all the pieces together, but I knew there was something there I needed to explore. And that was 1998. And by 2003, I was leading a chapter of Students for Sensible Drugs Policy and Normal at UC Santa Cruz. And it's just been going ever since. I worked with the American Civil Liberties Union for several years, doing drug law reform work there. And then I moved to the UK to do my graduate studies. And while I was there, I spent doing a lot of different projects there. But the big one was spending a year with the Met Police in London, riding along with them for a year to see how they actually dealt with drug issues.
Wow.
So surprised not very well. So I did that.
That must have been quite an experience.
What's up?
That must have been quite the experience.
Yeah, you know what? I developed a real appreciation for the challenges of policing there. I can be critical of policing in many ways and see a lot of the shortcomings and challenges that are brought into the current situation. But at the same time, I've seen how difficult it is firsthand, and how incentives to engage in certain kinds of performance really shape activities there. So it was a real eye-opening.
Policing really is like if you're going to be an officer, you already live a very clean lifestyle, anyways. Like you're probably never anybody that was involved in drugs or crime, or you were the good kid in class. Like you know what I mean? Like that's who those the type of people that get into policing. So they don't have the tendency of knowing.
Yeah, I mean, there's been a bit of changes. I think you're starting to see a little bit more leeway on past drug use, and in fact, even the Canadian Armed Forces. I mean, they're so desperate for folks that they've been loosening up that quite a bit, and they even changed their regulations around how long in between sort of duty and consumption that people could have. They've shortened those windows. considerably. But yeah, working with police was a real eye opener. I thought I understood the way that those things worked, and I realized that there was a lot more to learn, and it was a difficult experience at times, but it was also a really great experience to see, proverbially how the sausage is made, and to try and better understand that. And I moved to Canada in 2013. My wife is Canadian. We met in the UK there, and she pulled me back here to Canada. And I've been focused on cannabis education and really trying to make up ground for all the stuff that I didn't have when I was a teenager, and looking for some guidance and some information. And what we've built in the last few years is stigma-free, harm reduction cannabis education that doesn't say cannabis is perfect. It says, listen, cannabis is a minimally harmful drug, less so than many others, but still not free totally of harms. But here's things that you can action and that you can do to reduce those harms. And it's that kind of applied information that was, any information was really wanting, but that harm reduction focus, that applied information, and really taking a turn towards benefit maximization to say, how can we ensure that people are having a good, safe, enjoyable experience with cannabis? And not surprisingly, some people find this radical and promoting of drugs, and you've heard the arguments there. But we view it as the best way to keep people safe and having good experiences.
Well, ultimately, that's why it was legalized. It was for public health and safety.
Exactly.
I know for a fact that it was never meant to be an industry. That was nothing that was ever mentioned at any point when the policy was being, written for the party, or when we were looking at legalization as a, overall aspect. It wasn't to see who could get rich. It was to make sure that it was tested, that it was being kept off the streets, away from the kids. Like, as much as there are children that absolutely need it and use it for medicine, there are kids out there that shouldn't be using it because of the fact that it does, can delay some, brain activities. And, there's, studies that are proving these things, right?
Yeah. And we've seen it, the industry that's developed is pretty interesting. I feel like the Liberals were keen to make sure that it was a tolerated idea, and to do that, they wanted to bring the business community into play. But we've seen many other countries now pursuing legalization and not taking that pathway. Germany, Malta, Luxembourg, they're all moving towards the cannabis social club model, which Uruguay has as part of its legalization. It's not particularly thriving down there because Uruguay has very tight restrictions on the clubs and on purchasing. But it's a nonprofit model that many other countries are considering pursuing, because I wrote a book chapter with a great cannabis researcher in BC, Riel Kapler.
Yes, I know Riel.
Okay, excellent. And we wrote this book chapter all about how when you take cannabis and put it as just another commodity, you take the sacred and make it profane. And you potentially lose some of the elements of community knowledge, community gathering. You lose what the compassion clubs had, a place for people to learn and to sort of have a community bond. And this is, particularly true in the medical community. So many people who are using medical cannabis and facing serious medical issues, being sick is an isolating experience, right? If you can't work, if you can't go out much, having opportunities to be part of community is a really important thing. My first real substantive cannabis research was with the Women's Alliance for Medical Marijuana. I don't know if you're familiar with them, but Valerie Corral and Mike Corral.
Yeah.
They had So
that was one of the other groups when I was at the beginning of the show. That was one of the groups that I was aware of.
They were great. They were a patient collective, and about 75% of their members were terminally ill. And they had in fact, I think I saw you scrolling through my website there.
I did.
That picture that you had with Mike Corral. Yeah. So they had an acre of cannabis in the hills above Santa Cruz. And there it is. That's, if you scroll down just a little bit, you can see the picture of Mike Corral standing. I took that picture in the field when the winter cover crop was there. And it was an amazing place. Nobody paid for their cannabis. It was all free. Everybody worked what they could and did what they could to support the collective.
Wow.
And it was, I wrote my undergraduate thesis on them. and I called it Naked to Each Other, because it was not about the cannabis. It was about the connection and the community that people were finding, and the ability to learn about cannabis from one another. And I remember, do you remember the old plug-in vapes that were like a wooden box with the heating element in it, and then like a long
Yeah.
tube?
Right.
So
And
there
then
was a
there was
woman
another
there.
one. Yeah.
Yeah, she
Yeah.
was new to consuming cannabis. She had cancer. And I don't recall if she'd ever smoked before, maybe like once a long time ago. And she was sitting at a table at the Tuesday night sort of meeting that WHAM always had. And she was saying to someone, and I was right next to her, that she's like, the first day the cannabis worked really well, but since then it hasn't been working very well. And the person said, "Oh, really? Like, well, let's think about what's going on." And she said, "Yeah, look, the cannabis is still in there, but it's not working." And she didn't realize that in a vaporizer, you're not going to combust the
Yeah.
cannabis. So she had this like super dry bud in there that was, completely spent of any cannabinoid it might have ever had. So the person explained to her, "Oh, okay, well, this is what you need to do. This is how you need to frequently need to change it, how you know when it's ready." And it was that kind of knowledge and learning that was really important at WHAM. And, retail stores, they can't match that right now. Part of that's the legislation, but it's really, it's unfortunate that we can't have that level of knowledge. And so the work that we've done with our research team, we've tried to make up for some of that.
Good. I think I know the vaporizer had a whip on it, and probably a glass end that you stuck over top of a heat source.
Yeah.
You guys still have?
They've been supplanted by some newer ones there, but
I don't know that I actually pretty much Brenda sent it to me back in 2008.
That's
when we were doing that fundraiser for Mark, and he sent me two. He sent me one for me and one for a prize for our fundraising raffle gift, right?
Oh,
and that just died like 2 years ago. And I'm sure if I parts for it, probably still work.
So now you're as you said, you went through California, you've been over to the UK, you've met your wife, you've come here to Canada.
Yeah, je suis Canadian, yeah.
Yeah. And how about here? Now you're at Humber College, right?
Yep. Yeah, so at Humber, I lead our cannabis education research team, is what we call it. And I'm also a professor, and I lead our Center for Social Innovation. But the cannabis research is something that's really, as I said, close to my heart. It's trying to make up for some of the shortcomings there. And we did a big project the last few years called Weed Out Misinformation, where we built an entirely new public education campaign with bud tenders, with cannabis consumers, and really tried to understand where people were getting their cannabis information, what kind of information they needed, and to identify the different ways that we could best deliver cannabis information. So we surveyed 1,598 cannabis consumers, which was well beyond what we thought we would get, but people were really excited about the research and the opportunity to share their voice. And it's been good. We've had some retail stores pick up the materials from the Weed Out Misinformation campaign, but the big thing that we learned from the Weed Out Misinformation campaign was that people really wanted access to experts. It was nice that they, had the website that we built, weedoutmisinformation.ca, and they liked the information that was there, but they really wanted people in their community that they could turn to. But they didn't feel comfortable talking with their physicians. It's a bit too close of a relationship. Many people also felt their physicians were a bit stigmatizing or not well informed about cannabis. And so we thought long and hard, how do we find the right folks to, train up so that they could deliver the kind of stigma-free, harm reduction cannabis education that was needed. And we figured that pharmacists would be our best bet. And if you think about it, there's 48,000 pharmacists across Canada, and they are ubiquitous, right? Every town has a pharmacy in it, most likely. I got distracted one day and a little bored at work, and I tried to find the smallest towns in Canada and then see if they had pharmacies. And there were a few that didn't, but even some that were, 25, 30, 40 people, had a pharmacy
Oh,
in them,
really?
or at least nearby. And so they're a low barrier access point for information. And pharmacists are already trained in how to deliver harm reduction information for opioid users.
Mhm.
People who use opioids are able to access pharmacies for methadone, buprenorphine, things like that,
Mhm.
for safe supply of hydromorphone. And we thought, well, pharmacists can handle cannabis. If they can handle supporting people who consume opioids, then they can support cannabis consumers as well. So our current project, which is called Pharmacists as Cannabis Educators, PACE. So same name there.
Pretty close.
Yeah. So
Your
just
people
please don't
advocated
sue
cannabis
us.
education.
Don't sue us. But so our latest project is just launching. Actually, yesterday is when we launched the survey, and we're looking to get another 1,500 Canadians who consume cannabis of all ages, and to find out how they're consuming cannabis, who they're going to for cannabis information, and how comfortable they would be with going to different medical providers and pharmacists, and really trying to understand how we can tailor the information that we might have for pharmacists. Because if we don't actually have the information that cannabis consumers want, and we don't have it in the format they want, then it doesn't matter how many pharmacists we train. So we've got two surveys. We've got the one for consumers and the one for pharmacists. And they're both up and running now. And I think it's a great opportunity for consumers to help us figure out how to best train up pharmacists so that every pharmacist in Canada has access to continuing education training that will allow them to get up to speed on the latest cannabis issues, how to talk about cannabis. It's simple things. I did some work with the Canadian Public Health Association, and we redid some training for health professionals,
Mhm.
and it was called Canna Basics, like super basic, low level. Like, this is cannabis. It comes from a male and female plant. The female plant, like really low level stuff, assuming you know nothing. And one of the things we included in there, and I think will be important for pharmacists, is that we put in a hypothetical scenario where someone was talking about cannabis, and we broke it down, because you might know, and I'm hesitant to use a real producer's name here, but you might know, John's Farms Cannabis and their OG Kush, right? And that might be how you talk about cannabis to someone, but a pharmacist or healthcare provider might not have that information, and it might sound like gobbledygook to them if you came in and started talking about this and saying, "I'm using John's Farms OG Kush to deal with X, Y, and Z," and they'd be like, "I'm sorry, what? What are you talking
Yeah.
about? I know what that is." So starting off with those basics is going to be really important, but beyond that, we really need to hear from cannabis consumers about what it is that they want pharmacists to know, what kind of interactions they want to be able to have. And that way we can build all of our materials in partnership with consumers during some focus groups and some feedback sessions. So that's our new push. And you can take the survey at cannabiseducationresearch.ca. That's the website for our team's work. You can learn about our team. You can learn about our funding, everything that we're doing, fully transparent, how we're going to use your data. All of that stuff's available. Cannabiseducationresearch.ca.
That's awesome.
Yeah, and it's what you're doing is there's a saying that we had when I was writing for Treating Yourself magazine, that was a medical cannabis magazine that came out of Toronto, and we would always say that we're educating the educated and the uneducated. And what you're doing is you are educating the educated, because obviously the pharmacists are educated people.
Right.
And
Are
now
we going to distribute as well, or is this just going to be education?
Sorry, what?
Will they be distributing as well as educating, or are they just going to be educating?
Well, you know what? I mean, right now, there's a few pharmacists who've pushed the envelope a bit on opened medical cannabis or gotten medical cannabis dispensing capabilities. There's one in Ottawa, I know, and several others are looking into it. My suspicion is that cannabis products of some kind will eventually be in pharmacies. So this project isn't about advocating, but I think we're trying to get ahead of the curve. We saw pharmacists as a viable group to train up, and that I genuinely say pharmacists are great because you can walk into a pharmacist; it's totally no barrier, right? But a pharmacist doesn't always know your name, and you don't always know your pharmacist. Although since I turned 40, my pharmacist does know my name. But before that, he didn't. Before that, I was just another random dude in there once in a while.
Right.
But I guess I'm seeing him too much these days. But it's a different relationship than it is with a physician, and so we're hopeful that the not anonymity, but the less intense relationship that you have. Like my pharmacist has never seen me naked, right? Let's put it like that.
Right.
And I don't see any way that that's changing anytime soon. But but we think that they're going to be a good bet. And beyond that, I think it's likely that eventually there'll be some products in there. Whether that includes like dried flower and dabs and things like that, I don't know. But I think eventually we'll see some shift that way.
I could see capsules and things along that line, suppositories, things that I look at that
medicinal things, right?
things that you wouldn't think would be in a recreational store.
Yeah, like suppositories.
Yeah.
It's alcohol. Like if you had a suppository full of alcohol and you were selling alcohol-filled suppositories at the liquor store, people would be wondering what in the hell. Right? But
Can I tell you the most awkward part of my job I've ever had? This is when I was with the ACLU. I had to review at one point footage of DEA officials in the US talking about some drug stuff related to a lawsuit that we had. And so I was going through hours and hours and hours of DEA people talking at various events. And this was back, I was looking at these on VHS tapes. So there was no like easy searching through there, or, getting a digital transcript or anything. And the most awkward thing I've ever come across in my work was this super straight-laced DEA agent talking about MDMA ingestion practices of ravers. And he was so uncomfortable because he had to talk about rectal administration of of MDMA.
Right.
And he was so uncomfortable that the awkwardness of it just came through, and you felt bad for him. It's like, yeah, he's a DEA agent. I don't want to feel bad for this guy, but I feel bad because this is so outside his comfort zone. And he just looked pained, just horribly pained by it.
Really, like weirdly, like when somebody comes with cancer and you start suggesting suppositories, and you look at like, what the hell are you talking about? But again, if those were alcohol filled, being sold out of a liquor store, like they're being sold out of the recreational cannabis stores, wouldn't you be looking at people kind of going, what the fuck?
Yeah. I mean, people have been inhaling alcohol. That was the thing that was going on for a while. Sounds like a bad experience.
Well, I know that the pharmacy that I deal with, they have cannabis literature right on the counter where you go to pick up your medication and where you place your order. They have access to a number that calls and do all that stuff. So I thought it was really good to see that there. And actually, I think there's a poster on the wall.
Really?
Yeah.
Oh, next time you go in there, grab me a copy. I'd love to.
Okay, sure.
And see what it is.
Yeah. I'll grab one from there.
There are some enlightened, but there are really more unenlightened. That still have the stigma. But I mean, because I've got pharmaceuticals, I have to tell my pharmacy that I'm using cannabis too, right?
Oh, so yeah. It's super important because there's several enzymes that are affected by cannabis consumption. I think it's I always get this wrong. It's the P450 enzyme, and that's heavily involved in the metabolism of a variety of drugs. And cannabis slows down the metabolism that enzyme generates. And I was actually talking with a researcher who looks at emergency department visits due to drugs of various kinds. And she was telling me, surprisingly, that a lot of cannabis-related emergency department visits aren't actually about someone greening out or eating too many edibles. There's a significant number that are that, and that's an education issue that we can talk about. But you're saying that a lot of people don't tell their physician or their pharmacist about their cannabis consumption, and the medication that they're put on needs that enzyme to metabolize it. And what happens is that their cannabis consumption gets in the way of the body metabolizing that drug, and essentially they end up having a bit of an overdose on that other drug. So it can be antidepressants or a variety of other medications, and it's not the cannabis that they have a real problem with. It's that the cannabis impacts their body's regulation of other drugs there, and they end up in a pretty bad situation. So
Oh, wow.
it is really important that pharmacists have the right training. And we did a review of all 11 universities that conduct pharmacy degrees of various kinds in Canada. And we looked at all of the materials that they're using, and they all talk about drug interactions with cannabis. So that's good. But the problem is most of them don't have anything in there about consumption, CBD dosing, THC dosing, harm reduction, anything like that. So they really, they can tell you, oh, hey, don't consume cannabis if you're taking this medicine. But unfortunately, for many pharmacists, that's the end of the conversation right now. And we're hoping to change that.
Good. I hope you're successful at that, because I look at it as pharmacists, as you said, they're a person that connects to sick people, and the fact that not everybody knows where to turn to, but they might feel comfortable talking to their pharmacist. Yeah, not everybody's got a doctor, and not everybody knows anybody's got anything to do with cannabis. Right? So, all right. I see the time, around the hour. It's time for us to take a break. And when we return, Tamara and I will continue our discussion with Dr. Daniel Baer, Humber College. This is the Pace Radio Show. We're live here at paceradio.net and cbgtv.com.
You're listening to the Pace Radio Network, here at paceradio.net.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
Are you looking to get your medical cannabis grow license? Limestone City Hydroponics can help patients through the process of obtaining their license to grow medical cannabis. What's that? You don't have a doctor. If you meet the medical criteria, Limestone City Hydroponics has a nurse practitioner who can assess and provide medical cannabis prescriptions. What are you waiting for? Contact Limestone City Hydroponics at limestonecityhydroponics.ca or call them at 613-548-0420.
What do you find at paceradio.net? People advocating cannabis education.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Cannabis edibles are an effective way to manage pain and other ailments, especially when you deal with your trusted partner, Legacy 420, in Tyendinaga Mohawk territory. You see, we lab test every product on site to ensure proper dosage every time, which is critical when consuming cannabis edibles. All Legacy 420 edibles are made by our classically trained baker and chocolatier, and we also have super tasty vegan options.
Our baker has been in the industry for 25 years. She's also a chocolatier. Everything from savory to sweet, your chocolate bars, brownies, butter tarts, you name it, we make it.
Talk to our knowledgeable Cannatex about our incredible variety available. Give your trusted partners a call. Legacy 420 out on your road.
You're listening to the Pace Radio Network here at paceradio.net.
All right, we're back. Tamara and I were joined tonight by our guest, Dr. Daniel Bear of Humber College, and we're talking about surveys and cannabis education that's going to help educate pharmacists. So if you want a chance to educate the educated, check out Dr. Daniel Bear's research website that you can find at cannabisresearch.ca, correct?
Cannabis education research. Yeah.
Okay.
That's awesome
All right.
that it's being done, though. It's being done at Humber.
Yes.
Like,
Yeah,
that's
you know what I mean? It's a great, Humber is really great as an institution. You know, the college system in Ontario is really focused on applied learning, you know, and applied research. How can we actually make a difference? So we don't just do theoretical work on cannabis. You know, we did the research for the Weed Out Misinformation campaign. We talked to consumers, we talked to bud tenders, we talked to public health experts, and then we built the public education campaign from that information. You know, it's really about making sure that we're impacting the community in a positive way.
Yeah.
except for those mad commercials. Like, who's in charge of those mad commercials? Because those are kind of
Not me.
like, seriously, because I'm all about where the cannabis plant taxation money is going, right? Because so much money is going to the province, and it's going towards law reform and cannabis addiction recovery, and I'm like, and then MAD's getting a portion of it too, so they can make stupid commercials with dancing doobies, like seriously, like
I haven't seen that one.
Oh,
I've seen that one. Quebec had some out that told you that it said about making your neck stretch, and they have people with giraffe necks on them.
Oh, I think I did see that one. Yeah, I mean, listen, drugs education has been so bad for so long.
The frying pan and the egg. Okay, that's my generation, right?
No, I remember that. I remember that well, and it, you know, I think about the intentions of the people who did that. I believe that those people really felt that they were going to make a difference and improve people's lives and save them from the pains of drugs. But what they were doing was not giving them the information to actually make a difference. They left them high and dry. And so if someone did choose to consume drugs, whether that be cannabis or cocaine or anything else, they were left without the information about how to do so in a safe manner. And, you know, that is, if you think that you're going to be successful and no one's ever going to consume drugs because you have the best public service announcement ever, okay, great. You can stop at the prevention messaging. But if you think that people are going to consume drugs and you're not going to give them information about what they need to do to be safe, then I don't know what you think you're actually accomplishing in the long term. And it's unfortunate that for so long it was considered okay to just simply say, don't do drugs. You know, Nancy Reagan's just say no. And to leave it at that. And how many people's lives were harmed because no one ever said, okay, don't do drugs. But if you do drugs, why are you doing that drug? What do you want out of this experience? Why are you trying to achieve that experience with this drug? Do you know how to achieve that experience with this drug safely? And those are questions that are difficult to answer and require some introspection and requires taking time to educate people and to train them and to give them the critical thinking skills. And that's a lot harder than just saying no. And I'm a firm believer that we can provide opportunities to talk to people to change the way that they think about their own drugs consumption so that they are making as informed a decision as they can, because drugs can be, you know, have really positive effects on individuals. I know that my cannabis use when I was, you know, dealing with PTSD, it allowed me to go back to school. It allowed me to, you know, my teachers were like, "Oh, it's so great that you're back in school." And I was like, "Yeah, because I'm high." Like, I didn't tell them that. But I also know that at a couple points there, I was smoking way too much, and I was using it instead of dealing with the trauma. I was using it just to sort of push down the trauma a little bit, and that wasn't great for me. You know, I was not dealing with the issues as well as I could have. So had someone said to me, "Well, why are you smoking so much? What are you trying to do?" Okay, you're trying to deal with the flashbacks and the horrific pain that you're dealing with. Okay, let's talk about how cannabis can be used as part of that solution. But no one ever had that conversation with me then, and I'm hopeful that we can create a generation of people who are able to have that conversation with their loved ones or with their kids, or who, when they have, young people now, who when they have kids, they approach things a bit differently.
Yeah.
Yeah. Oh, yeah. Yeah. I know when I first told mine that I was, becoming a licensed patient and I'd be able to consume cannabis for my Crohn's disease. There was some concerns. So, we had dairy graduates in the house, and
Yeah.
you know how those things can go, and so.
My mom was RCMP.
And then that person went on, that the child of mine went on to do a thesis on medicinal cannabis while she was in college.
Wow.
I
Yeah,
think it's more we educate younger, like our kids, and our kids are educating their kids. That more interest of what cannabinoids and how cannabinoids and natural health medicine is actually really becoming something that's mainstream now. Whereas 20, 30 years ago, even if you said the word ginseng, people were looking at you like, so cannabis now is kind of being worked, and I think in the same kind of aspect, because we're medicinal. And we've said this as patients for a long time, that even if you're not, or you don't feel you are, you really are, because it's so much preventative benefits for the usage of it, as well as sleeping and eating and other things too. Like,
yeah, I mean, Valerie Corral always used to say at WHAM that all use is therapeutic. In her eyes, there was benefit being derived, and now, as we're developing our knowledge of different cannabinoids, the effects of CBG for appetite suppression and potential enhancements in focus, the potential sedative and relaxing effects of CBN. I was talking with someone a while back about what the future of cannabis might look like. And I don't think we're anywhere near this vision that I have, but I don't think it's an impossible one, where in maybe, let's say, 15 or 20 years, someone will be able to say, okay, this plant, we've got all, 113-ish cannabinoids marked in here. We've been able to test for all of them. And we know it's got this profile. And we know that your endocannabinoid system, based on this test, responds best to these things. And so based on what you're looking for and your endocannabinoid system, we can fine tune the right product for you, and connect people. I know, I don't know if you know the folks over at Elion Med and the system they've developed to try and match the scientific information about different medical properties related to different cannabinoids and different illnesses. And they've got a pretty cool system there, but where you can put in sort of what your symptoms are, and they'll pop up with some suggestions around, hey, this cannabinoid's been shown to help with this thing. Here's a product that contains that. And I kind of envision that, but on steroids in a while, where we can really understand our endocannabinoid system better, and we can understand the cannabis plant better.
How do you, is there a test specific for that yet?
No, but one day.
But I don't think that's I think what your vision there is very achievable.
Yeah, I do too.
Yeah. Unfortunately, it won't be around tomorrow, but if it came back, in time and years, I always say I'd like to come back in 100 years to see how cannabis legalization.
There is testing now to break down to the CBN and what percentage of CBG and stuff. Well, we didn't have that 10 years ago either, right?
No.
Yeah, exactly.
So, these are evolving and progressing. But even that drug testing machine that Dana has, it's a light spectrum machine, pretty much, right? That and they've got them at labs pretty much everywhere. I don't know why they're not using them.
You talked to Dana Larson last week, right?
Yeah.
Correct.
Yeah, that's a tough act to follow right there.
And he just got he just got his business license back.
Oh, he did? Oh, wow. Okay.
Yeah.
They were shut down. The mushroom dispensary had been shut down in Vancouver, but they'd gone to court and got their business license back that day. So we kind of snagged him on his way home.
Oh, wow.
Yeah. To sell mushrooms, DMT, and
MDMA.
LSD. I can't remember exactly what all he said.
I mean, it's a business license from the city of Vancouver. It's not a license from Health Canada saying, "Hey."
Correct.
Yeah.
right?
Yeah, yeah.
I mean, sure.
At least 2 years, anyways, and that could change once a new council comes in or whatever, right? But
You
for
know,
now,
because in British Columbia, like I said, said last week, we've got the, possession of certain like small amounts for possession, right? It's been decriminalized out here. I don't understand why they're breaking things into this is and this isn't and that, then it's regulated. So if everything's being decriminalized, you have to be able to have access to it, right? And that's something we were saying too. Like, even though you can, there possess a small amount of, cocaine per se, there's still no safe access to that cocaine. So you can go and pick up whatever it is, 2.5 grams, and not get get, say, arrested to be holding that, but you don't know what's in that.
Yeah.
And there's still no safe access. Well, with cannabis, at least we know when we're going to the store, we're picking up that, ounce or whatever. We know there's nothing else in that. It's been tested, right?
Yeah, and that's one of the things, I jokingly say nobody buys illicit honey baked ham, right? Nobody's like going to an alley and finding a guy with a cooler who's got a ham in there, and he's like, "Hey, this ham's $2 cheaper," and you're like, "Yeah, no, I'd rather go to the regulated store." Like, especially when the regulated store, there's like 3 around the block from me.
So many people are still so offended by that whole part, like legalization, by not being like, and I was like, to be honest, I was probably one of the biggest advocates against LPs, and I don't want to do this, and I don't want to.
Those early days.
Yeah.
Yeah.
Really, like, don't shut down our legacy dispensaries and stuff. But at the end of the day, I'm not buying moldy pot. I'm not buying bags of seeds. I'm not buying, and I'm not having to wait 24 hours. I'm meeting somebody in the Safeway parking lot, right?
Yeah.
So
It's I think there's an interesting disconnect between the consumer experience under Canadian legalization and the industry's experience, because if you go to for example, like I went to the Cannabis Council of Canada's Grass on the Hill event back in October, and everybody in the industry is saying, listen, we can't make ends meet. The taxes are too high. The payment terms aren't set up well. They had 100 reasons why things were going wrong. And I totally feel for them. Like, there's a lot of unnecessary burden put on the industry here. But at the same time, I think if you ask a consumer, how's legalization going? They'd be like, yeah, it's great. It's easy. Like, it's fine. I get what I want. Some people might complain about the strength or quantity of edibles, particularly, if they're used to higher amounts or, are using medically, on a sort of very frequent basis. But your average consumer who's consuming a couple times a week at most, if we're talking like, straight, actual average person, right smack dab in the middle, they're consuming once in a while. It's easy to get. The price isn't really that expensive, right? Like, if we're down at $5 a gram now, and you want a couple joints, you want a couple pre-rolls in a 2-pack that comes out to, $7, for on the way as you and your buddy walk to a hockey game or something, that's not considered overly burdensome, and it's super easy to get. So I think consumers are having a fine time with it. Most of them. I mean, obviously some are wanting higher strength products in various ways, and I think our 10 milligram per package limit is far too low, but the industry is definitely struggling. And I wouldn't have advocated for a fully for-profit industry. I would have offered the idea of a for-profit industry tied to social justice outcomes and focus on social justice outcomes, but then also building in a nonprofit, either social club model or nonprofit production facility option that had lower taxes, that had incentives, that had wage subsidies.
We've got LPs that are not even, like, they're producing in Canada and selling in the other markets, like abroad, because of our taxes. They're like producing here, and then they're selling to Israel, and they're selling to Germany.
Yeah, and Italy, Germany, also all over. I mean, it's kind of cool that Canadian cannabis is fueling the medical cannabis industries around the world in places that haven't legalized recreation. But I mean, we've got 1.5 billion grams still sitting in warehouses at the moment.
Yeah.
Something ain't right there.
Yeah. There's lots. There's no doubt about that.
And that's, I don't even know who do you blame for that? Corporate, the government is handing out too many licensing. They should have put a cap on how many licensing, but they weren't really sure what the consumer and the supply and demand was going to be until the market got started. And then once somebody's put, $5 million into a facility, how can you tell them to stop?
Yeah.
Yeah.
It's the overproduction of cannabis is one of the most surprising things, because I remember in the lead up to legalization, Health Canada had a tracker for medical cannabis statistics, and you could look at the number of patients being served, the average amount each patient was prescribed or allowed, but you could also look at the inventory of the medical cannabis suppliers. And in the 2 years or so leading up to legalization, their stockpile sitting in warehouses went from, a couple thousand pounds to many, many hundreds of thousands of pounds.
Because they outpriced themselves.
They were ready for a massive surge. And, while most people now buy their cannabis from legal sources, the latest data suggest about 3% of people never buy legal. Most everybody else is buying legal at least some of the time. There's just not that many, even if 27% of people consume cannabis, there's just not that many people that you need 2 million square meters of growing space for.
No, yeah.
Our population doesn't need, there's more cannabis in Canada than there is people.
Yeah. No, I wonder, with all the empty grow facilities we have right now, it's like, why isn't Canada the hothouse pepper leader of the world? Like, why aren't we growing all of our tomatoes?
Tomatoes and stuff for all those facilities that, that what's his name there in Calgary bought in Redcliffe, in Alberta there with I can't remember what Aurora. Yeah, Aurora. And then Canada, there's just ridiculous amounts of money that was just poof.
Yeah, it's amazing. I remember I've never bought any cannabis company stock because I felt, as a researcher, I didn't want any perception of undue influence or any biases or anything like that. So I never bought any cannabis stock.
Me either.
There were a couple points there where, like, Aurora and Canopy and that stock was growing and growing, and I was like, man, I when I thought about buying it, it was at like $5. Now it's at like $60, and I was kind of kicking myself, going, man, you and your stupid ethics. Like, that's
right.
It would have been okay. It would have been fine.
I had a friend that did though. He lost his shirt. Like, he lost a whole pile of money. So
yeah,
I saw Canopy. I saw Canopy when it was still under $1 originally.
Yeah,
and then at one point I saw it was like $174, and I think, holy smokes! But if anybody who got into it back then when it was under $1, I didn't know anything about stocks or buying stocks or nothing, but I remember it being out for $1 and going, wow, less than $1, and then it went up to $170 or something at one point.
Yeah,
then huge money.
I mean, the only one good thing I can say is, having met so many people in the industry, I know there's a lot of really good people working there. There's some shady schmoes who just want to make a buck off cannabis and don't really care about it. There's a lot of people who really do care, and particularly in some of the smaller producers now. I won't name any names because I don't want to seem to be, favoriting or biased towards anybody. But some of the folks I've met at some of the smaller producers, and they're not even that small anymore, but smaller privately owned producers that are run by people who really care about the plant. I think they would have gotten into this whether they could have made a profit or whether it was nonprofit or whether, whatever model was put into place. They care about it so much so that they would have gotten into it. And the quality of the products that they're putting out are really phenomenal. And, I'm an infrequent cannabis consumer, and most of the time not flower. But some of the flower that I've seen, just in terms of the structure of it, the color of it, the smell, the some that I've tried, like, people are putting out really amazing stuff, and it's really a testament to maybe not just ingenuity, but the drive that some people really have to make this succeed. And it's been unfortunate that so many large players sort of muddied the water initially, and that the policies that are in place have limited the viability of some of the market. I'm fully in favor of a nonprofit model being introduced, but I can also appreciate people who are in a for-profit business there, feeling bad that they're not able to make a profit that they think they could genuinely make because of the regulations that they're facing. So I'm really excited to see the Cannabis Act review findings come out. I think theoretically they're getting it to the Minister of Health the end of this month, with some time in April or May that it'll be tabled in the Commons and become public. But I'm really interested to see how they're going to balance the public health needs of cannabis consumers, but also the industry's needs to have a little bit easier go of it. So it'll be really interesting to see how they make that those two things balance.
My interest is whether they're going to cut the medical cannabis program right out.
Yeah, I mean that's really up there for an interesting outcome. I don't know. I've seen some people arguing that keeping a specific medical context is important while regulation in the rec market are still quite tight. And I've seen others who say get rid of it. We don't need it. And
what about the mother? What about the mother who has a 5-year-old child that has epilepsy and can use some cannabis oil and help them with their with their seizures? They can't expect them just to go to a recreational store for access.
Risk for law too, because then you're putting yourself at risk.
Exactly. 14 years in jail.
Right?
Yeah.
Because you're serving it to a minor. So there's no parental protection on that law, on that legislation at all. So what risk?
Yeah. Unfortunately, question 5.2 of the Cannabis Review Act questions whether the brick and mortar stores could replace the medical program. Is basically what it comes down to.
Right. Because access. Now there's access, right? Because that's what the biggest thing was with patients. We didn't have access.
Yeah, the in the mail delivery system was.
Yeah.
And I don't know who initially thought this will be the way we solve it, but.
Oh my God. Did you ever get any of that pencil shavings? Like, good.
I did. I got my little golden envelope. I got one. I bought one just to see what it was like.
It was horrible. It was like, ground up. It tasted like pencil shavings. It was.
Yeah, it was no bud. It was already milled.
It was already milled. Like, it was already ground up, and I think it was stem and leaf and everything all just piled into a great big grinder, and they're just putting it out. I don't think it was cured or anything. It was just.
Yeah. And the strain was Cannabis Sativa L.
Yeah.
That was it. Yeah, things have changed big time.
A bit. I think back to when I was a young person first starting to learn about cannabis, and I remember someone was saying, what did he say? He said, I don't want to paraphrase it because it's not as good, but he said something like, "Oh, it's the good weed because it's green." And I was like, "What?" He said, "Good weed is green," and that was like the level of knowledge we had at the time. We're like, "Oh, okay, good weed is green," and it
was brown,
and a lot of it was brown and full of seeds back then. And
if you dried your mouth, if you couldn't spit on the ground, that was
or you get a bag of green weed, but it was like cut, put into a bag. And there you go for $40.
Well,
no
I remember,
try, no nothing. Just here you go, clipped off the plant. There you go.
When I was, I did some work when I was doing my doctoral work with the police in the UK. Actually, sorry, this was during my master's work with them. But I was with an undercover team that was watching drug deals go down in London, and I remember watching this guy. He would sit, and he would do this repeatedly. He would sit on this like grassy little knoll and just pull the grass up and throw it into bags. And the bags had a little bit of cannabis in it, just so that when people smelled it, it smelled a bit of cannabis. But he would throw the actual grass clippings into there and then sell it to people walking by. And then the police would go and give a cannabis warning to the people who bought it, and basically say, now you have to be a witness when we arrest this guy. You have to be a witness, and we'll, so we have better testimony against him if he actually goes to trial. And I felt it's like, man, you're going to get busted for selling literal grass shavings. Like that's a bad day for you. That's not a great use of police resources, but that's a really bad day for you.
When I was in high school, one of the kids that I went to high school with was selling vials of oil at the arcade. And once they tested them, it was molasses. And another quick story for you. My buddy in Lethbridge got busted with the biggest outdoor grow ever in Lethbridge, and they were daisies.
Oh, molasses and daisies. Wow.
That's how swift the policing, yeah. So, like, I won't say, my mom was with the RCMP for many years. I'm not going to say anything bad about the police, but they were daisies.
Daisies.
And they had them on the front page.
Daisies.
And garbage bags. So I'm serious, like big garbage bags full of these daisies on the front page of the Lethbridge Herald going, biggest outdoor grow ever found in Lethbridge, blah, blah, blah. And then they were daisies. I had them in my house, in my front yard in Tabor, too. They were
daisies. All right. I see the time. It's the top of the hour. Time for us to take another break. We're going to pay some bills. When we get back, we'll continue our discussion with our guest, Dr. Daniel Bear of Humber College. You're watching or listening to Pace Radio Show. We're live here at paceradio.net and cbgtv.com.
Announcing CBGTV's Bud Break book. Get your copy now. Detailed strain reviews. Every purchase supports the ongoing efforts of CBGTV. Available from Amazon and at cbgtv.com or scan the QR code.
You're listening to the Pace Radio Network here at paceradio.net.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
Are you looking to get your medical cannabis grow license? Limestone City Hydroponics can help patients through the process of obtaining their license to grow medical cannabis. What's that? You don't have a doctor. If you meet the medical criteria, Limestone City Hydroponics has a nurse practitioner who can assess and provide medical cannabis prescriptions. What are you waiting for? Contact Limestone City Hydroponics at limestonecityhydroponics.ca or call them at 613-548-0420.
What do you find at paceradio.net? People advocating cannabis education.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Cannabis edibles are an effective way to manage pain and other ailments, especially when you deal with your trusted partner, Legacy 420, in Tyendinaga Mohawk territory. You see, we lab test every product on site to ensure proper dosage every time, which is critical when consuming cannabis edibles. All Legacy 420 edibles are made by our classically trained baker and chocolatier, and we also have super tasty vegan options.
Our baker has been in the industry for 25 years. She's also a chocolatier. Everything from savory to sweet, your chocolate bars, brownies, butter tarts, you name it, we make it.
Talk to our knowledgeable Cannatex about our incredible variety available. Give your trusted partners a call. Legacy 420 out on your road.
You're listening to the Pace Radio Network here at paceradio.net.
And we're back. We're live, and we're with our guest, Dr. Daniel Bear of Humber College. We've been talking about his survey, cannabis survey, a lot of his advocacy stuff over the past years, and I'm sure we'll get to maybe where the future is. And let's just I might have a question that leads us to the future. I seen something on the write-up on you. The Canadian Global Cannabis Cultivation Research Consortium.
Yeah,
What's-
we picked the longest possible name.
Yeah.
Yeah. So the GCCRC is what we call it, the Global Cannabis Cultivation Research Consortium. Clearly, this was a name created before Twitter was invented, but it was it's a project that I lead the Canadian team for that, and it's a survey of cannabis growers from around the world. Our last survey, which wrapped up last year, I think we had, I want to say, just over 15,000 growers from around the world that responded.
Wow.
We only had about 600 in Canada. I was hoping for a bit more than that. Actually, do you want to guess which country had the most respondents?
The U.S.
Nope. No, Belgium.
Belgium, where it's not even legal to grow.
I know. It was wild. I think because it's a small country and there's only a few cannabis grow shops there, that they all go to those grow shops. And because we had a couple posters up in those grow shops, it got really good traction there. But it's a great project.
Okay, what's the legalities in Belgium? Is it
so for a while, cannabis social clubs were tolerated in Belgium, not so much anymore. Growing's illegal there, but they are quite good at it and quite fond of it, apparently. But the GCCRC, our website there is worldwideweed.nl. It's based in the Netherlands, as where or at least our website is based there. But it's a project with 18 different countries participating. I lead the Canadian team, but we've got, let's see, UK, Germany, Argentina just joined, Australia, the Republic of Georgia. God, I can't remember all 18 of them, but it's a great team of researchers from around the world. And we really wanted to understand the growing practices of small scale growers. And that's in the context of small scale, not a micro grower or a microprocessor, but people growing at home and
Patients.
Yeah, patients, anybody who grows medical cannabis. And as I said, we had about 600 respondents in Canada last time, which was still enough to do some good research. We're writing up some of our results right now, but we actually sent our results to the Cannabis Act Review when they were asking for submissions, to point out that our findings are pretty simple to what's the word I'm looking for? To synthesize. That's the word I was looking for. Escaping me for a second. Our findings are pretty simple. They are that cannabis growers are, on average, basically the same as every other Canadian. In terms of employment, in terms of having kids at home or not, their age. We found that it was skewed towards men. The average respondent for us was about a 42-year-old man. But we saw significant increases in the number of women who reported growing, particularly because of COVID as a reason that they cited. I jokingly say that during COVID, you either learned how to make sourdough or you learned how to grow weed.
That's pretty much it. That's pretty much.
Yeah.
But there's a significant, I think, number of people that aren't patients that aren't growing anymore either. Myself included, right?
Yeah, I mean, you can find stuff and get it pretty easily. It's hard to grow. I mean, it does grow like a weed, but
we had a really significant, license, and when we lived on the farm, but we're again now in town and power, right? So and that was we had like 200 plant licensing. So
oh wow,
that's yeah.
It's sorry.
No, it's more than just throwing a seed in the ground and giving it water.
No, we had a 4-stage grow, like yeah. It was a full-time job.
Yeah. Mother Nature should grow indoors.
It was. But so I think it's significant. Well, I don't know. Like, I know that somewhere I read that the numbers of medical cannabis patients in Canada had dropped.
Oh, significantly. Yeah. We're seeing. I don't remember the exact percentage, but I think it's down to about 170,000 folks now, if I recall correctly. And the peak was well over 200. But it's been dropping.
10,000 of us.
Yeah.
Like back in 2012, when we got our license, like when I got my license, there was 10,000.
Wow.
last I saw, it was over 40,000 people that were growing at one time.
Yeah, that's really low. That's significantly higher than it was 20 years ago, but it's still down. 'Cause I know there was a plow there. We went through a kind of like I don't know, it was a recruitment or something. And Dr. Camerman probably signed 5.
A lot of us wrote their pound in the pavement.
Yeah.
Yeah, for sure. I wanted to review some of the stuff again on your survey. We still got 20 minutes before we're done here, but I've got your survey here, and I see that it's got some questions on it. So I thought that maybe we review that before we end up the show, and people have a little bit better understanding on, what the purpose of it, what's happens with the data that's collected, privacy, so on and so forth. I believe that's all touched on here. So this is basically a consent form that people are going to sign to say that I want to be involved in this.
Yeah, exactly. We've gone through a full ethics review with the Humber College Research Ethics Board and have full sign off from them. I actually used to be on the Research Ethics Board, so I understand the processes very well. And we take the data protection very seriously. We use a Qualtrics as our survey tool, and so the data stay in Canada, and we're making sure that we're not collecting any unnecessary personal information or tracking anybody. The only data that's collected that might be in any way identifying, and it actually isn't identifying, but we've got some just tools on there to prevent bots from using the survey, because there is a gift card that you can win. You can enter to win a gift card, and the last survey, I said that we had 1,598 respondents in our last project. We actually had more than 2,000 respondents, but 400 of those were a bot that just spammed us all at once. And that was quite nice. Thankfully, it was not a very good bot, and we could spot the pattern of answers and figure out which answers were from the bot and which ones weren't. But no, we take the privacy very seriously. We don't capture any information that isn't necessary, and we list all of our partners. So our team is comprised of 4 faculty at Humber College here in Toronto, and then 2 researchers at Memorial University of Newfoundland. And then our partners are the Canadian Pharmacists Association, who are a great organization and really solidly behind this project. They're really keen to see pharmacists get the kind of training and information they need. And we're also working with the Canadian Centre for Substance Abuse, which is a really prominent organization that does a lot of drugs research and drugs education. And then our third partner on this is the Canadian Public Health Association, who we've done work with in the past, and they've got a really solid team of drugs researchers there. And all 3 organizations are really great to work with, because they not only each bring a different perspective on the issue and different data that we can access from some of their previous work, but they're all solidly behind the harm reduction focus of our work and really ensuring that people get stigma-free harm reduction information. And on top of our research partners, we also have an advisory committee that's comprised of people with lived and living experience as medical patients, as cannabis consumers, who help guide our work and make sure that that we've got an equity, diversity, and inclusive lens around our work, that we're not accidentally including stigmatizing information. So we really think we've built a solid platform to gather consumer info. And I will point out that after the survey, there's an opportunity to let us know if you want to be involved potentially in a focus group that we're going to be running, because the survey collects one side of the data, but after this we're going to be having focus groups with people to help construct some of the materials, and then as we refine the materials, go back to consumers to say, hey, here's the next version of what we've built. How does this look to you? How does this resonate with you? And we've actually got a couple sessions planned where we're going to have consumers and pharmacists work together to help build some new materials that'll be used in store.
What's the feedback from the pharmacists? Are you getting any feedback from them? Has there been any backlash or anybody kind of saying we're not interested in doing this? Or
not yet, thankfully. We haven't launched the outreach campaign to pharmacists yet. That's going to start in a couple days. I'm sure there'll be some pharmacists who say, why the hell are you doing this? As I'm sure if we went to any profession, there would be.
Yeah.
But I'm confident that we're going to get a good response from the pharmacists, because I think, many of them, if they've got their own shop, they're a small business owner, right?
Yeah.
They're
Mhm.
looking for ways to get people in the door to, say, hey, look, I offer something that my competitor doesn't. And
Well,
I can
didn't
envision
Scotland
people.
get the medical distribution license at one time? I think I heard.
I know there's one pharmacy where they got a medical cannabis. Did he get a distribution license? I can't remember
Yeah,
exactly what he got.
I'm
Yeah.
pretty sure the Shoppers Drug Mart got a cannabis distribution license.
Nice.
I
Well,
don't know if they ever did distribute.
No, they stopped. They were
Yeah.
into it, and then they pulled out.
Correct.
I guess this was about 2 years ago, I want to say.
Yeah,
Yeah.
they stopped that. Yeah. Hydro Farm in Ottawa.
Okay, yeah. Is that
Yeah.
that's Raheem Dalla who opened that
Yeah.
one? Yeah.
Yeah. Now, as far as your survey,
This dispensary in Canada, right? In Ottawa,
yeah,
right?
yeah, exactly. Yeah. Now, as far as your survey, it says, "What will I do if I choose to do the study?" I see it takes what 20 minutes for people to complete it.
We say 20 minutes. That's the long end of it. I think probably more like 10 to 12, depending on how quickly you go through it. We actually took out a bunch of stuff because, as
Yeah.
researchers, we figure, oh, we got you in to take the survey. We want to ask you every question we could possibly ever need to know the answer to related to this. And then we realized it was a bit too long. So I think it's likely more sort of around 12 minutes, 15 if you go a bit slow, 20 if you really take your time. A number of the questions we set up so that it's the same lead in and then just asking you a slightly different thing, so that you don't
Right.
have to read a full question each time, and just do a quick sort of 5-point scale. I completely disagree to completely agree. And so
Right.
with those ones, I think especially, once you read the first one, it kind of goes boom, 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 boom for the next ones.
Medical and non-medical questions.
Yeah. So we ask about why you consume cannabis as part of this, to understand if there might be different profiles and different needs for different kinds of consumers.
Mhm.
And you get asked basically the same questions after that.
People can avoid answering questions if they don't feel
Any
comfortable.
question you don't want to answer, you just say, most all of them have a I choose not to answer button.
Mhm.
And we do that just so we know that you answered it, but said, I don't want to answer it. If we leave it blank, it's kind of a problem, because then we don't know if you just skipped the answer or forgot to answer it or something.
Right.
So most all of them
Right.
have a I choose not to answer button. Yeah.
Now I see here everything, and you mentioned this earlier. Everything is done anonymously. No
Everything is done
identifying.
anonymously. Yep.
Yeah.
We make sure that no information is collected and kept. We have a warning in there that says, if you really want to be safe, use Tor or a VPN or some other
Right.
thing.
Yeah.
We're not asking anything salacious. We're not asking you about, tell me how many crimes you've committed. It's nothing like that. We just want to understand how people are consuming cannabis. We don't ask necessarily.
Hey, Health
We don't
Canada
cover your
doesn't have any problem sending our stuff out without any privacy. So
Yeah. So
Yeah.
we're very concerned about making sure that people not only are safe, but that they feel safe when they're taking our survey, because we're asking people to talk about something that's important to them,
Mhm.
and we can't treat that data flippantly.
No, exactly. Now I see you got a chance. You can win. You can win some gift certificate, gift
That's right.
cards.
Yep. We'll do a drawing for 5 $100 gift cards at the end of it. And the way that we actually collect your information, because you might say, well, how are you going to know who to send the gift card
Yeah.
to? So the way that we set it up, and this is a pretty common thing in academic research. So we have our main survey, which asks you all your questions, and at the end of it, it says, "Do you want to be entered into a gift card drawing?" And if you click yes, it actually takes you to an entirely new survey, so that we can't take your answer and where you put in your email, and I think we have like which gift card you want, but that way your email information isn't part of your original survey answers. It's a
Right.
totally separate survey, so that we can't connect answers back to an email.
Nice.
Yeah.
Good.
And
Good.
we've thought this through. We protect people.
Yeah. And then you go on about how it's going to be used in different publications and
Yep.
all that.
Yeah, this is an academic survey. The goal is to develop knowledge and develop the resources that we can provide to pharmacists. The pharmacists, we're going to create a continuing education course for pharmacists that'll be free to them. We're also going to create in-store materials that'll be created using a Creative Commons license, so that they'll be printed out for pharmacists if they want them, but anybody can download them and use them and access them. So, we believe very strongly that because we're getting Canadian federal money to develop this research, that it needs to be accessible to Canadians and available to them, and not hidden behind a paywall there.
Exactly. Good stuff. Exactly. And I see here you can withdraw if you get partway through or whatever. You can withdraw out of the survey.
Yep. If you just decide you don't want to do it, you just close the survey. It's simple as that. Unfortunately, if you submit the survey after that, we can't withdraw your information, simply because we don't know which one is yours. It's that anonymous. So if you close the survey, we assume after a period of time, I think it's set for a week. So if you close it and come back to the link within a week, it'll take you right back to where you were. After a week, it just closes it down and says, okay, this person just stopped, and that's it.
Yeah. I see there it says you can't remove your data once it's been submitted. And there is obviously certain criteria that has to be met before you can do the survey.
Yep. As long as you live in Canada, as long as you're 18 years of age or older, and as long as you have used cannabis at least once in your life or are considering doing so in the future. We wanted to make sure that we didn't just capture current cannabis consumers, but people who might say, I don't consume now, but if I had a medical reason to, I might. We want to make sure that we've got their information when figuring out what kinds of materials we need to produce for the pharmacies.
Yeah. Now it says follow up. Are you looking at reaching out to these people down the road? I guess everything's separated, so it'd be hard to do something like that. Whether you would get the same people to fill out the survey in another 10 years type thing.
So if you enter the gift card drawing, we do just say that we will potentially reach out to you to let you know about the outcome of the survey, or to see if you want to participate in any other part of the process, like with focus groups. But we aren't selling anybody's information. We aren't keeping a database where we start handing stuff out. We make sure that we use it only for things related to this survey. So we're excited to launch this. This is the coming on your show is the sort of the launch announcement for it.
Good.
So we did a soft launch yesterday just to make sure it was working. And thankfully the survey seems to be up and holding steady. And we're really excited. I'm really hopeful that we can surpass the 1,598 respondents we got on our last project. And I'm hopeful that your listeners will go to cannabiseducationresearch.ca, take the survey. Admittedly, 10, 12 minutes of your time. It's people are busy. I know sitting down for that is not always the easiest thing to find time to do. But this work is important because we think that people need additional opportunities to access information from trusted sources. We think pharmacies are going to be a good place to do that. We've got good partners on board to help ensure national distribution of the materials that are eventually created out of this. But we're not going to create materials that don't come from the voice of cannabis consumers, because those materials wouldn't be particularly effective if we just made them on our own. Some of our team consumes cannabis, some of them don't. But nevertheless, we're not the voice of cannabis consumers. We're researchers here to listen and to build new education materials for pharmacists and new guide materials, resources for people, so that when they go into a pharmacy and they talk to a pharmacist who's been trained by the stuff that we're creating, that they also have access to a pamphlet or a resource that they can then take away with them and continue their learning and their education. Have that interaction with the pharmacist and then walk away and continue to learn.
Well, I'm super glad that they want to learn, because I remember one time, and I'm sure Tamara remembers too, that the pharmacists didn't want to have anything to do with it. And that could have been because they didn't know anything. And it's great to see that there's somebody like yourself that's out there trying to collect this information so you can go out there and educate.
And with doctors, though, still, the stigma still, attached. And I don't know, say it again, it'll be 120 millionth time. Health Canada recognizes cannabis as medicine.
Yeah, they don't.
Yeah, it's a real challenge. The physicians, their guidance that they get from their colleges of practice are really quite limited about what they can and should recommend cannabis for. I think in Ontario, family physicians have 5 listed ailments that their college of practice says you should consider cannabis for, and that's only after every other treatment has not worked. And it's that kind of language which does limit people. And I went to my physician to ask the question, and she's great. I love her to death. I wouldn't change physicians in a heartbeat. And she was just like, I don't really know that answer about cannabis. It's not really something I deal with. It's it's not part of the pharmacopoeia that they're regularly exposed to, and it's a real challenge. I mean, just as pharmacists need to have their training changed, I think long-term physicians would be too. And initially, my conceptualization of this work was that we would target physicians. That was my initial idea. But once we kept hearing from cannabis consumers in our last project that they weren't having good experiences with their physician, we didn't think it was a good idea to then say, okay, well, we've solved the problem with your physician, because people still have that sour taste in their mouth. So we thought, the low barrier nature of pharmacists, the lack of previous sort of interactions there, it actually creates maybe a better opportunity to help people. And so that's why we've got this survey going. That's why we call it pharmacists as cannabis educators, because we think that they can play a new role.
What about the interaction with pharmacists and possibly educating doctors? Like, once, you know what I mean? Like the interaction between the two, because they do interact, because they have to, fill the prescriptions that a doctor is given. Maybe that interaction with educating pharmacists will then rub off onto the doctors.
I think I could see elements of that happening. I'm hopeful that long term, that if we're successful with this project, if we create materials that really reflect the voice of cannabis consumers, create education materials that support pharmacists and get them the training they need, I'm hopeful that in the long term, we might see physicians groups start to say, hey, actually, you know what? This pharmacist education seems to be going pretty well. I'm seeing this more and more from my patients asking me questions. Let's figure out how we can get our training increased so that physicians, because there are opportunities. There are physicians that have undergone more training, that have specialized. Like, there are elements of it there. But I think until you get the colleges of practice, the family physicians of Ontario and those types of groups on board, then you're not going to have that widespread dissemination of knowledge. But I'm hopeful that they see success.
Canada to see it the way it is. How do we change the whole dynamic on that?
I wish that I had influence with Health Canada.
Right?
One step at a time. I've gotten into the pharmacist. Give me time to get into Health Canada.
I'm really happy to see that colleges are actually giving platforms to, for you to do the research. Like, that's a step forward too. Like, I know there was research being done in Montreal at University as well. So that's a really positive thing for everybody.
Loyalists in Belleville, they've got a big...
Actually, I was just talking with the leader of the marijuana cannabis. What do they call it? It's something. I can't remember the name of the lab there, but I was just actually talking with them today at Loyalist. We're going to be doing some work together. Hopefully. And, it's the colleges, our mandate is to put forward applied learning, applied research to really have positive impacts on our community. And so projects like this coming out of Humber, the work out of Loyalist, other colleges as well, are, I think, really important and really are the epitome of that kind of applied work, where it says, okay, let's learn something and take that learning and put it back into the community.
Absolutely.
I've got, we could talk all night, but I've got 2 questions. One of them relates to the survey, and when is there a time frame of when it ends?
We're hoping to keep it open for about 2 months. We're going to launch our focus groups in May, and so we're hoping to close the survey just before then, so we can analyze the survey a little bit, and that way it influences the discussions we have in the focus groups. But I figure about 2 months from now.
Yeah. And the other question I have was, being that social justice issues, harm reduction, and that leads me. Do you ever think that you'll ever get to the point where you might get involved in the psychedelics end of things?
Oh, I think for sure. Yeah, I think I think psychedelics and theogens. There's a huge wave coming. I was actually just having a conversation with someone the other day about how I love working in cannabis and drugs policy in general, but I think we need to be, particularly at the colleges, thinking about what comes next and how we can ensure the kinds of education and training. We had everything from Cheech and Chong to Pineapple Express,
Yeah.
media depictions of cannabis, not always accurate, not always flattering, but at least in society, there was enough people consuming, there were media depictions, that our education about cannabis, there was a little bit of a base there. I think the level of education and knowledge and training that people have around psychedelics is far less, and they really don't understand it. And if we move towards any sort of wider access, whether that's in a medical model or recreation, whatever it is, we've got a lot more ground to cover to help ensure that there's harm reduction focused, stigma free, benefit maximization education about these different products. And I think, Dana Larson, as we talked about earlier, he's starting to see some distribution there. And I'm sure there's plenty of people who are well versed enough to handle them without any problem. But once this moves into a wider audience, there's going to be a lot of people who aren't, and we have to consider how we can best support them.
Right.
Education, knowledge is power, and the way you get knowledge is through education, right?
I think there should be. I think there should be courses at colleges to teach people these things.
There have been some. Unfortunately, was it Seneca College? I think it was Seneca. It was one of them. They had some courses. They had some cannabis programs, and they ended up shutting them. There was big interest
for cannabis retail.
Yeah, there was some focus on cannabis retail. I know Niagara has a really cool cannabis growing program that they still do. There's a few others out there. I know TMU in Toronto Metropolitan University, they had a cannabis business program that closed. It's tough right now because there's not a lot of money in industry, so industry isn't sending their folks, and not a ton of people are going to cannabis courses. I teach a drugs and society course, which it fills up right away. People love it, which we have a lot of great discussions about cannabis and other drugs, but there's not a ton of stuff out there, unfortunately.
Right.
Because we do, I do a news broadcast here on the network, and we touch on psychedelics, and it just seems like every once in a while there, quite often actually, there's new information that's coming out that's help people with mental health issues, and it just blows me away thinking that because being around the 60s and 70s, and now this stuff is coming out as beneficial to everybody. So
yeah, it'll be an interesting few years ahead of us.
Yeah, absolutely. All right, Tamara, you got anything that you wanna ask Daniel?
No, I think we covered lots. I could probably talk to him for the 3 hours, but no, we'll stop now, or I'll just keep on blathering. So,
is there anything you want to touch on, Daniel, that we didn't talk about?
No, I just appreciate the opportunity to come on and talk about the work that we're doing, and I just really want to encourage people to go to cannabiseducationresearch.ca. They can also check us out on Instagram, on Facebook. We're on Twitter. Basically, there's a social media channel you can find us, but
Right.
cannabiseducationresearch.ca, that's the main page for our projects and the way to access our surveys, whether you're a consumer or pharmacist. It's funny, we talk about consumers or pharmacists. I'm sure there's pharmacists that are also consumers.
I'm sure there are.
They can take either survey, I guess.
Yeah, actually, I think if you check out the 420 radio show, maybe you might find one there.
Yeah, I know, yeah.
So, all right. Other than that, you've done all your social media. Anything else you want to throw a shout out at?
And thank you to my daughter who has gone to bed nicely tonight, and so I'm not getting a daddy. So shout out to her for going to bed nicely.
All right,
appreciate
sounds good. Okay, just a reminder that Tamara and I will be back next Wednesday with our special guest. We got someone who's lined up that he's having an event that I haven't heard of before, so this is going to be interesting. So, but other than that, you can find Pace on Twitter. We're on Facebook. We're on Instagram. And you can find us online at paceradio.net or pace-online.ca. Thanks to our sponsors, helpful folks at legacy420.com, Camelford Lifestyle Shop, as well as Limestone City Hydroponics. And big thank you to our guest, Dr. Daniel Briere. Thanks, Bear. Bear, for coming on to the show. We really appreciate you coming on and taking this time to speak to us and our audience.
Cheers.
Yeah.
Appreciate it.
Sure.
Thanks, Tamara. And thanks to our listeners for tuning in the program. We'll see you all next week. Thank you and good night.
Good night.
The opinions of the individuals during this broadcast are their own, and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
You're listening to the Pace Radio Network here at paceradio.net.